This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Before we do anything, we must start by saying Happy Mother's Day.
To all the women out there.
All
the women out there.
Good to have you with us. As always, it's another edition of the Mother's Day edition of Health Watch here on Talk Radio 1210 WPHT. I'm John DeMasi with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We talk about here on the show the who, what, when, where, why, and how of Innovative Medical Associates, how it can help you and your family improve your overall quality of life, and in general, just really doing our best to improve your quality of life here on the show. 855-839-1210 is the number, 855-839-1210 at any time during the course of the show. If you have a question or a comment for Dr. Molly, or you want to run by her a medical challenge that you may be having, feel free to do so, 855-839-1210. And as always, Dr. Molly, a pleasure and happy Mother's Day.
Thank you, John. You know, it's a funny thing. You don't necessarily have to be a biological mother or an adoptive mother to be honored on this day. How many women in people's lives have influenced them for the positive?
Right.
Think of the teachers, the professors, the pastors, your neighbors who helped you out in a time of stress, all of those things. I'll tell you, I think although we associate this holiday with women who've had children in one way or another, the bottom line is it's really every woman's holiday.
Right, it sure is. And I remember a neighbor of my mother's. She taught me my first words. You know what my first words were?
What?
Stinking crabgrass.
Oh, my goodness. But, you know, you do.
That's right.
You know.
I still remember that.
That's right. And, you know, people really should take a minute and realize all of the wonderful things that women have contributed to this world. I mean, you know, we laugh about it. We laugh about, you know, our moms, and I have fond memories of my mother who's gone now for a few years, and I know you do too. Yeah. But honestly, look at the effect that they had on our life, John.
Yes, they did.
You know, your mother was a dynamo.
Oh, yeah.
I'll never forget it. All the times. This is a little side chatter, but important today. You know, John, do you remember we were doing the show out of your kitchen? Do you remember that?
Yes.
And your mom would come down and she'd sit in, and at the break she'd give me some advice, and she certainly gave you plenty. And it was all good. You know, my mother used to come to my clinic 2-3 times a week by train from South Philly. Yes. And I look back on that and I think to myself, by the way, she lived to a pretty darn good ripe old age, my mom.
Yeah, it was close to 90.
Yes,
right?
yes. And I would tell you that I think about the gusto that she had to do that, right, in her 70s and early 80s.
Well, your mother was famous for walking from where you lived in South Philly.
That's right.
To Center City.
Almost every day. Every day.
I couldn't do that now.
You know, well, I don't like hearing that, John, but it's true. You know, but what I'm saying is, let's give all the women in our life a little nod today.
Okay. Well, we'll get started now as we took a little aside for Mother's Day. Tell us about Innovative Medical.
Sure.
Why you are different from what you could expect from a primary care facility.
Sure. Well, we are a like-minded group of providers, and I believe I have like-minded nurses there as well, who are providers in addition. And we work out of a primary care facility. So, yes, we can do everything that a primary care facility can do. You need an antibiotic. Just this week, I had a patient who came in, and unfortunately, she was bitten by a tick in the Poconos, and Lord, I could see the bullseye already. The doctor quickly ordered a round of doxycycline, which is the traditional remedy. But she came right in for her IV therapies, and we sort of mixed them up a little bit so we can hopefully get some of the bacteria and the virus that these darn things leave in our body and sort of preempt anything that might be worse. So again, you can see we're able to do both worlds, and we believe in that. We believe in Western or conventional medicine when you need it, and we also believe in the hydration therapy as a vehicle to deliver natural substances to augment and possibly help reduce your need for the conventional pharmaceuticals, thereby reducing some of those side effects.
Now, I believe, of course, because I've been a patient for 20 years, but
Yeah.
most people in the initial consultation at least say to you, yeah, but Dr. Molly, does this work?
Right, right. So here we go. Here we go. As I like to say, why don't you come in and start talking to the patients? That's number one. Qualitative data. I couldn't walk 4 blocks before I started treatment with you. Now I can walk a mile. Qualitative data in that I'm getting up in the morning with less pain. Those kinds of issues, you can talk to patients, talk to me, and I can show you. Then there's quantitative data. You have blood work. Your lipids started at 300, your cholesterol. Well, after we're done a course of chelation, you may be down to 220. And guess what? If we do an additional 10 treatments or so, you probably go down to normal range, assuming that you do the lifestyle changes that we ask you to do as well. So again, I won't tell you throw away your statin drugs or throw away the other category of drugs that work on our lipids, but if we can enhance them in such a way that you can reduce how much you need to take, guess what? That's a win for us.
That sure is. How much can you expect when you go in, again, the initial consultation? So you're gonna sign up for the treatments.
Sure.
How much can you expect,
over course of time?
Yeah.
Yeah, it could be anywhere from 5 weeks to 15 weeks, John, before we see changes. And again, that's going to depend on the severity of what you're coming in for. You know, my biggest thing is, I say this every week. I wish people would come in the beginning of their challenge rather than towards the end of their challenge, which makes it more challenging for me and more challenging for my docs to really put together the protocol that we need to do to really enhance your quality of life. So these are the things we talk about also in the initial consultation.
What seems to work best? What conditions work best with your treatments? Is it heart?
Wow.
Is it cancer?
I would say we certainly have a track record for cardiovascular, lipidemia. We have a great track record on Lyme disease, which we'll talk about at a later date, and autoimmune diseases in terms of improving quality of life. Of course, I have a tremendous amount of cancer supportive patients who we're doing, and I can tell you that for the most part, we certainly have improved their ability to continue their conventional treatments. And for those who didn't want any conventional treatments, I think that we helped certainly prolong their journey in the cancer therapy.
Now, we should be clear. You don't tell patients, get rid of your oncologist or your doctor or your specialist. No,
absolutely
this is
not.
To enhance.
Now, sometimes in that enhancement, we see miracles, and I won't say we don't. We have, and we can talk about that at some other time. But it's an amazing thing. You take a patient who calls in here often, Pam, right? Pam. She, to me, is an absolute miracle because she's managed to be cancer-free. However, she did a somewhat conventional. She just did not want to do what? The chemotherapy or the radiation therapy. But I'll be darned, she did what I believe is first line of defense. If you can get the cancer out, you want to get that beast. And she did that and then did a preemptive type of surgery as well. So these are the things. And would we help, would my physicians and myself help a patient through their cancer journey? Yes. If there are things out there that we think can help them. For example, I just spoke to another patient this week, and I gave her a referral to an interventional radiologist who was able to do something and ablate some growths on her liver. Now, again, that is a medical procedure. We don't do it. I don't give medical advice, but was actually acting as her advocate and steered her to somebody who I thought could make the assessment and do something to prolong her journey.
And that's your job, of course.
Right, right.
We are coming up on our first break of the morning. It's Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. If you have a question or a medical challenge you want to run by Dr. Molly, 855-839-1210 is the number. And again, we always tell you to call early. And last week we had a call that we took with a minute to go in the show.
Yes.
So
yes.
It just goes to show you, it just happens that way. But we encourage you to call early. 855-839-1210 is the number. With Dr. Molly Fantasia, I'm your host, John DeMasi. We will come back with more Health Watch after these words. We are back here on Health Watch, and as always, when the program is on, we have our operators standing by. And I should say that they're standing by, and they'll be there well after we leave you at 9 o'clock this morning. 856-489-0505 is the number. 856-489-0505. You call that number now, and what you really should do is set up an appointment to talk to Dr. Molly and go over your situation in its entirety. And the initial consultation is complimentary. So you don't have anything to lose, and it doesn't cost you anything. 856-489-0505. And, of course, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Check that out. A lot of good information on that as well. It's Health Watch every Sunday here, the live version, 8 till 9, right here in Talk Radio 1210, WPHT. And the number here, 855-839-1210. Dr. Molly, we're going to talk about my favorite and one of your favorites.
That's right.
Vitamin C.
Yeah, you know what, John? You're always saying about how you've reduced the amount of colds you've had this year, and it's helped your immune system, and you feel better when you do the twice a week because of your comorbidities.
Right.
You know, I'm not saying everybody has to do that, but in your case, you know, you have some things, some challenges out there that we always want to stay on top of.
Right.
But so everybody knows and everybody's heard about vitamin C and colds and immune system. But that's an amazing part of vitamin C story. But not too many people realize how many other incredible things vitamin C has a benefit for us. You know, too many people aren't getting enough, really, vitamin C, because, you know, we don't make it. We don't make vitamin C. We have to take it in, which is how this whole thing was discovered, you know, with scurvy. When they were away, they had nutritional deficiency of vitamin C, the sailors. So here we are. Too many people aren't getting enough to thrive and experience the vitamin's full, wonderful potential. So let me give you a little preface here. I was doing a little research on vitamin C, and I can tell you that there were too many medical articles. And again, I'm looking at vitamin C from the medical standpoint, but I went through a ton of articles and publications highlighting the benefits of vitamin C. And today I just want to give us a few of them. Did you know that vitamin C can protect your memory and thinking as you age?
No idea.
Well, let me tell you, folks, its powerful antioxidant properties can combat oxidative stress and inflammation in the brain associated with cognitive decline. Now, I want to tell you, I put that to the test this week on a patient who came in from Indiana. I ran every single marker that I could, not just the traditional ones, but I looked at some other things, like what was happening with his white cells. And I looked at an interleukin panel and a CD cell panel, which has to do with the immune system. Guess what? He was so high in so many of these, pointing to certain types of brain inflammation, that it blew me away. So obviously, in his protocols for the whole week, I was able to reduce some of those by utilizing a form of vitamin C. Now, how did I know that? Because on Friday, I ran the other test to show where he is, and I've seen movement. Is he completely normal? Heck no. How could I do that in 7 treatments? You know?
So let's see if we understand this.
Sure.
Vitamin C can protect your memory?
Yeah, it's associated with with cognitive decline. And unfortunately, as we age, we have this. Because why? We're taking in other things externally. And, the other thing is, John, as we get a little older, we don't eat as much as we used to eat. So you can be sure that we're certainly not getting enough in our nutrition. So some of the cognitive decline that's happening to us can be mitigated with vitamin C. Low levels of vitamin C have been linked to the impaired ability to think and remember. So that's all going with it. In other words, there are studies out there that show lower levels of vitamin C have been linked to people who have some memory problems. There's several studies out there with patients with cognitive decline that has lower levels of vitamin C in their blood serum level, in their blood work.
You're talking about vitamin C as you give it
at
your clinic.
That's exactly right.
Not people who drink orange juice
right.
3 times a day.
You're just not going to get enough, right? Because again, you have to realize, you're going to lose a whole lot of that in the gastric system. So we want to look at this. And you know what else? People get to a point, if you were really to take vitamin C orally, you have to titrate it to diarrhea. Not a very unpleasant thought, and most people can't do that. In order to know you're getting at least the lowest level of the therapeutic level, if you get what I'm saying. Yeah, right, okay.
People don't want that.
No, right. So vitamin C intake has been shown to be protective in thinking and memory as we age. So these are a few things that vitamin C can support in terms of the brain function and memory decline. But did you know that it also can protect our heart and cardiovascular system?
I didn't know that either.
No, but you know what? There was at least 10 or 15 studies that showed a combination of 10 years who took vitamin C orally, mind you, had a lower risk of heart disease. And we found that utilizing vitamin C with our chelation protocol tended to enhance the patient's cardiac outcome. And I've seen that both in we talked about how do we know it works. I've seen it used for measuring cardiac function through their ejection fraction and seen improvement after we reached a certain level of vitamin C along with the chelating agents. So this is the other thing. It also can promote healthier blood cholesterol and triglycerides levels. Is that unbelievable? So why wouldn't we use that in our chelation therapy? We would.
There's just an endless use of this vitamin C that
nobody talks about.
And
you know what's amazing? Like in our clinic, I extract vitamin C from many, many different types of substances. But I use what I believe is nature's vitamin C. I extract it from tapioca. I can extract it from beets. I can extract it from citrus fruit. Rose hips is another one. So again, you need to look at the extractions of vitamin C and how to utilize them. The other thing is we've seen that it helps lower blood pressures in healthy adults and those with a condition. So again, you can see how we use vitamin C along with our cardiotonics, right? When we're delivering chelation therapy.
There's just, it's endless. It just
goes
on
I have
and on.
more. I have more. It can help promote healthy support of your arteries. So what does that mean? It means maybe it can reduce the arterial inflammation that we see that contributes to things like what? Blood clots, etc. Yeah. So vitamin C is very important physiologically, also when we're under stress, John.
Back to the COVID. Remember that? I mean,
yeah.
Honestly, I never even sniffed COVID. Just because I came to you twice a week.
Well, I don't know. We can't say that was the cause and effect, but, because then we'll be beaten up by all the conventionalists. But I would say it certainly helped.
Yes.
Because we know you're always talking about improvement of the immune system. It absolutely has a place in that. But I think it also shows that high levels of vitamin C can help people reduce some of the physiological and the psychological changes that happen when we're having stressful situations. COVID was one of them. But an interesting fact about COVID is that people were using in the European cultures, were using it in their COVID treatment protocol. And part of that came about from a 2017 study about the use of vitamin C at a major hospital in the U.S. that helped a patient who had a lung issue that actually developed septicemia, which is a blood infection. And the vitamin C helped to improve that patient's outcomes in ICU. Now, again, these are small studies, John, but they're out there, and I want people to go start looking at them. So it turned that, in turn, what happens is vitamin C can help a lot of us actually bounce back from stressful situations, something I know you're under all the time. Anybody in business or has a stressful job is under, right? Higher levels of vitamin C and stress hormones, along with blood pressure, and those got lowered with the vitamin C following a stressful event. So in other words, when the stress hormones go up, if you use a proper amount of vitamin C, you may be able to lower those and help you successfully get through a stressful event.
Okay, we are coming up on our halfway point of the show.
Well, we have more, John.
Oh, but we have plenty more on vitamin C and, of course, some other things. And maybe your calls at 855-839-1210. That's our number here in the studio. And like I said, if you want to call now, because you make sure you get your call in before we leave you at 9 o'clock. 855-839-1210 is the number. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. Dr. Molly and I return with more of the show after these words. We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates, 856-489-0505. 856-489-0505 is the number. Just call them, and operators are standing by, as I said. And you really want to make the appointment with Dr. Molly for the initial consultation, and that's where you really learn how she can help you and whether or not this is for you. 856-489-0505 is the number, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Check out the website as well. Health Watch is the show every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is the number. Going to go to the phones. Tom in Pennsburg. Tom, you're on Health Watch with Dr. Molly. Good morning.
Hi, Tom.
Good morning. I've heard that 60 grams of vitamin C in an IV for cancer. Are you familiar with that?
Yes, sir, I am. Okay. Yeah. Okay.
And about how many treatments do they typically get for something in that range?
Well, it really depends. One of the things I don't like to say is that you want to be regulated by a protocol that says this is the amount of vitamin C that you want to use for a patient, depending on what type of cancer, sir, prostate or something else. Or can you tell me?
No, I'm just doing a general
search. Okay.
Question.
Yeah. Good.
Plus iodine for breast cancer. There's been a few cases where that's been successful. I was wondering if that's been used too.
Yeah, I think that's absolutely true, because one of the things you want to look at is you want to look at vitamin C actually taken with some other things that can help actually the epigenetic regulatory enzymes that we have. In other words, we're born with certain codes, right? And these enzymes and agents play a crucial role in tumor suppression. And the capacity of the high-dose vitamin C to promote certain productions can actually help in this genomic integrity. So, yeah, you're right. There is a way to do this. Now, I'm hesitant to say that it cures cancer, sir. I won't say that. But it can be a helpful role in cancer prevention and therapy. So I hope that answers your question. God
because
bless
I
you.
was a fan of Linus Pauling.
Me too. And actually, since you mentioned it, believe it or not, I went out to Wichita to study with Hugh Reardon. If you know that clinic, look it up, Reardon's Clinic, and they were tremendous supporters of Linus Pauling's work. And interestingly, I'm a member of the orthomolecular group right now that people are trying to say was crazy, and trust me, Dr. Pauling was not crazy. So it's a good thing. God bless you, sir.
Tom, thanks a lot for the
Hey,
call.
Tom,
Appreciate
thanks
it.
for doing all that research. You're a smart guy.
Linus Pauling is significant for
Yeah,
you
yeah.
because why?
Well, because he was the father of orthomolecular therapies. And again, I went out to Wichita to study at the Reardon Clinic, and I just was in love with orthomolecular, meaning vitamin C. In my early years, I would say, in doing this 27 years ago, we were tremendous fans, and I've seen the development of extracts of vitamin C that work. My thing is, I don't like to be arbitrary, John. Like when this gentleman, who's a smart guy, said 60 grams. Well, 60 grams is fine. That's like the traditional quote-unquote dose. But, there may be occasions where you want to look at utilizing vitamin C in a different way. And I didn't get up to that yet. So, he jumped the gun, but it was a good jump. And I just don't like to be arbitrary and say that's the amount of vitamin C we're going to give every cancer patient, because I can't say that.
Yeah,
Again,
you don't.
we individualize our treatment protocols, but I think our outcomes speak for themselves. And there's more and more research being done on the pro-inflammatory effects of vitamin C, but I don't want to get into those right at this moment.
How many studies, I think you were telling me before the show, there are 200 studies?
Over
200
200.
studies?
I was able this week to pull off 250 studies going back to the early 2000s on the use of vitamin C in cancer therapies and as an adjunct, and also in cancer therapies. And again, going back to what I said for this gentleman, you have to realize that today versus 20 years ago, as it progressed, now we're doing more and more with the immunotherapies, and there are numerous studies showing that if you utilize this vitamin C in a proper way with some immunotherapies, and again, you have to know the targeted therapies, because there are some immunotherapies you cannot use vitamin C with, so you sort of work your treatment protocol around that, the supportive protocol around that. But what you want to know is we can actually utilize this for some of the epigenic problems that patients have. I can tell you that they've used vitamin C in certain melanoma and colon tumors, and again, it drastically enhanced the T cell, the helper cells for patients. So, you want to look at this. You want to do this judiciously. You don't want to go for a spot. You don't want to go to a spot and tell them, give me 60 grams of vitamin C, and it's going to work for what I'm doing while you're getting immunotherapies, because you want to know the variations in the immunotherapies and what are they working on. And you want to make sure that the vitamin C then will work synergistically with that and not actually cause a problem while you're going through the immunotherapy.
Is there such a thing as when not to use vitamin C?
Yeah, there it is. For certain drugs, certain immunodrugs, you don't want to use vitamin C therapy because they're diametrically opposed. They're working, you need to have it work on a particular expression of RNA. And this is what you want to do. You want to look at the oxidative stress produced by you want to look at overcoming the oxidative stress. The other thing is, remember, chemotherapeutics are actually creating free radicals, and you'll hear me talk about that in the clinic. And so we don't want to use vitamin C in a way that disrupts that reaction, because it's that reaction that we found that helps the chemotherapy. So you've got to use vitamin C like you would any other thing in your toolbox. You want to use it appropriately, scientifically appropriate for what the patient has.
How do you determine what to use?
Well,
and
you got
what-
to sit down and do the archaeology on the chart, and you also have to sit down and say what drugs is a patient on, and can that interfere with the mechanism of the drug and what it is doing to the particular patient.
We have our favorite caller, Frank in the Northeast.
Oh,
Frank,
Frank's
good
on the
morning.
phone.
You're on
Hi.
Health Watch with Dr. Molly.
Hey, Frank, how are you?
Hey, well, good morning and happy Mother's Day, Dr.
Thank
Molly,
you.
and all the
Thank
mothers out there,
Thank you.
especially the lovely ladies at your office. They're all awesome.
Oh my gosh, thanks, Frank. They're going to love hearing that.
I forget
Thank
their
you.
names. I'm sorry, but Barbara, Fran, Catherine,
Yeah, you got them all. You got
Oh,
it.
what's her names? Carol. I forget their names. They're all great.
Thank you.
But Dr. Molly, on Mother's Day, I got a great joke for you. Okay.
Go ahead.
Knock knock.
Who's there?
C.
See?
See who?
Vitamin C you later.
Very good. Very good. Thanks,
Anyway,
Frank.
it's so stupid. I had to say it, though.
Thank you,
Anyway,
Frank.
happy Mother's Day again, Dr. Molly. Take care. Thank you very much.
Thank you.
Thank you, Frank.
Bye-bye.
Thanks
Thanks,
for
Frank. That was a
thanks for the
cute
kind
joke.
words.
Cute joke. But, let's talk about vitamin C in a situation like, we always know that people talk about vitamin C in skin, right?
Yes.
Right. One of my favorites and one of Dr. Glass's favorites, and we've used this in our skincare product line, right? Because we found that in 2017, I found a study that said that healthy skin contains higher levels of vitamin C. Healthy skin itself contains higher levels of vitamin C. Research has shown that higher levels of vitamin C intake. Now imagine, so using vitamin C IV is associated with better looking skin. That's why everybody looks so good in our clinic. Okay. As an antioxidant, vitamin C has been shown to act as an anti-inflammatory agent, which can soothe the skin while reducing puffiness. So that's why in some particular products I have out there, we use an organic vitamin C extract from natural sources. That's why the skin cream does so well around the eyes.
I've used it, I know.
Oh, great. And you look good, John.
Yes,
Come on. Okay. Vitamin C does what? It helps produce the collagen production, the protein that makes up the fabric of the skin. It can reduce skin sagging, which is why we want to use it, by aging, oxidative stress, and weight loss, actually. It can reduce, it actually protects us against UV damage, right? Which causes a lot of the discoloration in our skin and that kind of thing. So you can see that vitamin C has a lot of good qualities just in general, whether we use it IV, take it orally, and or apply it to the skin. But the real question is it doing more than boosting the immune system for the cancer patients? I touched on that a little bit. There are so many studies now since 2016 showing the antioxidant and the pro-oxidant activity of vitamin C and what can happen when it can help reduce some of tumor conditions. So what did they do? There's a wonderful study you can look at PubMed that says the data validates the role of vitamin C as an antioxidant under physiological conditions, exhibiting a crossover role as a pro-oxidant in pathological conditions. Now, get that concept, guys. It's saying in physiological conditions, we know that it's used as an antioxidant, but it exhibits the ability in pathological conditions, which would be like what, John? Bladder cancer, cancers, right?
Yes.
It can do this. Now, further studies have started to happen to really substantiate the use of the pro-oxidant activity. And this is why I say they're looking at this more and more in using it for autoimmune problems and also using it for cancer therapies and the immune-enhancing drugs that are coming out.
Okay, we're going to pick up that and more on vitamin C. This whole show is dedicated to vitamin C. Eight,
Scary, right?
855-839-1210 is our number here in the studio. 855-839-1210. Dr. Molly is here, and I'm your host, John DeMasi. We are coming back with more of today's edition of Health Watch after these words. We are back here on Health Watch, and again, operators are standing by, and they will be there well after we leave you at 9 o'clock. The number is 856-489-0505. That's 856-489-0505. That's the number for Innovative Medical Associates in Marlton, New Jersey. They'll be happy to take your call, and if you want to set up that appointment with Dr. Molly for the initial consultation, feel free to do that, and you'll really find out a lot of information as it pertains to your case. So you want to do that, 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show, you can catch us again this afternoon, 4 till 5. It's the Health Watch replay, Sunday afternoons here on Talk Radio 1210 WPHT. We're going to go to the phones right now. Steve is in Medford. Steve, good morning. You're on Health Watch with Dr. Molly.
Hi, Steve. Hey, Steve. How are you?
Happy Mother's Day, Dr. Molly.
Thank you. You too, Guy. I hope all the women in your life are having a good Mother's Day.
I hope so. Good show, by the way. Listen, I'm 80, but I'm diagnosed with, I have two issues, polymyalgia, which is under control. I take meds for that. Yeah. But I also have arthritis, and it's really flared up on me. They sent me to rehab for that, and they they exercised me and all that.
Sure.
The thing is, in my shoulders, they say I have bone on bone in both shoulders, and they move me around. It keeps popping, and the pain is getting worse and worse. I go back to the doctor, and they shoot me up with cortisone, and sometimes it helps, and sometimes it don't. But I mean.
Listen, you know what? You're not that far from me, my friend. Why don't you come in for a consult? Because I could talk a little bit more about some other things we do. And I got to tell you, I have a medical director who was an anesthesiologist for so many years, too many to count, and she had a pain management practice. She's not doing pain management anymore, but we are doing some very interesting things in terms of injectables in the shoulder. And possibly, look, bone on bone is rough, definitely. But also, I use a ton of homeopathics, and John's been there to see this, utilizing IV therapies in conjunction with some shots in the shoulder that really tends to hold down pain for a patient. I can't say it cures the pain. The patient may have to come in a few weeks and get some more IV. But I got to tell you, for the most part, they have had an enhanced quality of life where we've been able to reduce some of that pain, at least make it a little bearable. It sounds like you're in tremendous pain, buddy. And you know what? The other condition you have also contributes to pain. So may God bless you. What medication do they have you on for that, Steve?
Okay, well, here's what I take. Once a week, 24 milligrams of methotrexate.
Yeah. See, you're
That's one shot once a week.
Yeah.
And then I take every day 4 milligrams of methylprednisone plus 5 milligrams of folic acid.
Yeah,
I've been taking that for a long time.
Yeah. You think about the medication regime you're on. You're using a whole lot of steroidal compounds, too. So, they have good and they have bad. You know what I mean? But if the good's helping you, I'm glad it is. But
I have to get blood work every 6 months. And, I check my enzymes, and they won't give me the meds without checking my enzymes.
Right,
so they say that, I'm okay. But the thing is,
thank God.
I'm glad that's under control. But my arthritis, let me put it this way. I can only sleep on my back. I can't put no weight on my shoulders.
Oh, my God.
So,
oh, my God. That's terrible.
Let me ask you this. When I come in, do I bring in my blood work and all that kind of stuff?
Yes, please. That'll help drive the...
I did a lot of blood work, so I have all
please. Give me, results. And you know what? That'll help me. That'll help me drive what kind of therapies might be best. But I would really like to help you, my friend. It sounds terrible. You sound like you're a pretty smart guy, too. God bless you for looking at all this.
Steve,
man.
Thanks for the call. Call the operators right now, and you can set up that appointment.
Yeah, that's a terrible case. And I've seen a lot of that, man.
I can feel describing it.
Yeah, I mean, God bless him. God bless him.
Well, picking up on the vitamin C,
Sure.
we got a couple minutes left of the show. Autoimmune?
Yeah, John, of course we're using it in autoimmune. And, you know, if you subscribe to the school of thought that we do, that cancer is one of the autoimmune problems, you know, we believe that, look, in the last 50 years, there's been a lot of advancements in the use of vitamin C for autoimmune. It's been around since Linus Pauling, but more and more has really advanced our knowledge in terms of the biological roles and the process of vitamin C. But I got to tell you, we still don't know every single mechanism of this vitamin C, but we know that there are so many more nuggets that are coming out that offer solid scientific advice and scientific understanding of vitamin C in the treatment protocol. And I would urge everyone not to turn a blind eye to the use of vitamin C in cancer supportive care, because there is data now to support it if used correctly and not in antagonizing any of the drugs that a patient is going on for the chemo and or the immunotherapies. You could really see some reduction in the tumor helped by this vitamin C. Again, it's not the tumor. It's not going after, I'm not saying we're going after the cancer to cure it, but have we helped your quality of life? Yes. And you know what? One of my patients this week just showed me her new PET scan, and she called me and she said, Molly, look, the radiation did what you thought it was going to do, and look at the decrease in the tumor in another area. I said, that's right. I think that's probably as a result of how well her immune system is challenging this through the use of vitamin C.
But vitamin C does not conflict with medications.
Not always, no. But those that it does, you've got to go to a place where we can study that, look at the impact of your medication, whether it's the chemotherapy or whatever. It could also be as easy, John, as delivering your chemotherapy on such and such a date, and so many hours later, we can then deliver the vitamin C to enhance your outcome. So there are many ways I do this. You can't just say, and with the help of my wonderful physicians, I am able to really look at suppressing some of the downside to the cancer treatment protocol.
And once again, you can't get the kind of vitamin C you're giving
you're not going
in the health food store.
No, you can get something to help enhance your quality of life. I'm all for that, but it's not going to do what we're putting it out to do. That's the bottom line. And my belief is God's ingredients helps a lot.
And with that, we're going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates. 856-489-0505 is the number, and they will be there well after we leave you at 9 o'clock. They'll be there all day, in fact. 856-489-0505 is the number, and the website again, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of today's show or you want to hear it again, we're on again this afternoon, a replay of this morning's show, 4 until 5. Right here on Talk Radio 1210 WPH.D. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff Barbara, Catherine, Lana, and Donna, then of course there's Joanne, Delightful D, Fabulous Fran, and our nursing assistants Caring Kathy and Sandra. I'm your host, John DeMasi. Thank you for listening. Have yourself a great week. Happy Mother's Day, and of course a healthy one as well. We'll talk to you next Sunday, 8 till 9, Talk Health Watch, right here on Talk Radio 1210 WPH.D. Take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.